Hi everyone, I hope all is well. How is it
Hi,
going?
teacher.
Hi.
Yeah, we are good. What about you?
I'm fine too, a little bit bored. I miss my job, patients, and all of you. I hope we will meet as soon as and meet our patients as soon as also. I want to ask some questions to you to make sure our patients to clear their minds about COVID, about operations, about anything else, and diets. Dr. Mehmet and dietitian Sarah and our international patient coordinator Murat is here. First of all, let's start from COVID. Dr. Mehmet, what do you want to say about COVID? Do you have any advices for this disease, for this illness?
Yes, Tuğçe. In fact, this virus is a new member of well-known coronavirus family, but it's a little bit different. Also, we know of these other members of this family like MERS and like SARS, but this time I said it's different. This situation is more different. It's called pandemic. What's pandemic? So pandemic is the infection that covers whole world. The risk of contagiousness is very high, so we shouldn't leave the house. We shouldn't not have physical contact with anyone if possible, of course. And social distance is very important.
Okay, I can understand that staying at home is very important.
Very important, yeah.
Okay, thank you.
This virus spreads easily.
Okay, thank you, Dr. Mehmet.
Our possible candidates asked that why the planned surgeries were cancelled because of COVID.
There are several reasons for this. Because hospitals are now the source of virus, so we shouldn't even leave the house. Hospital are risky places now. If there may be an infection in the hospital, so it can be transmitted to our patient or us. In addition, healthcare professionals, doctors, nurses, and other professionals are required to allocate their energies and work time only the patient with COVID-19. So another reason is that if surgery has to be like cancer or urgent cases, this must be done by open method, not laparoscopically. Our surgeries are all laparoscopic methods, so we cannot do open method. This is another reason.
Thank you.
Dr. Mehmet, I want to ask that I can understand that obesity is important, but COVID is important also. Obesity disease is risk for COVID?
After surgery or before surgery?
Before and after.
Yes, obesity is a risk for COVID because this virus affects especially lungs. If you have any problem with your lungs, like asthma or any other disease, you are under risk. Also, obesity patients have lower lung capacities than the normal population. So to repeat, our patients should not leave the house. If it is mandatory, they should pay attention to the social distance, comply with the hygiene rules, and it's very important if they are smoking, if they are smokers, they should definitely quit smoking immediately.
Okay, after operation, the patient's immune system will be low?
If they cannot eat well or regular diet, yes, it will. But now we don't do surgeries, so there's no risk about this.
Okay, thank you, doctor.
Also, I would like to ask that, let's say a patient had COVID and then recovers. Would it this like a problem for the surgery?
Our routine is before surgery, we check our patient comprehensive examination Of course, our pulmonologist will check every detail, even if our patient needs CT scan. So no worries about surgery. Our patients are entrusted to us.
All right, thank you.
Doctor, I hope this virus will end as soon as, and we will start doing operations, treating our patients. I want to give I want to have some information about our treatments. Gastric sleeve and bypass and gastric balloon we are doing. But gastric sleeve and bypass is more important for the health. Is gastric sleeve or bypass safe long term? Which one do you advise?
It's changed patient to patient. If we talk about weight loss, the weight loss rates in the first year are roughly the same. We evaluate patients and their stories in detail, of course. We decide which surgery to do according to patient's conditions and the result of the tests. If the patients have diabetes or high blood pressure or any other related obesity-related disease, we prefer gastric bypass methods. But if the patient has no risk, has no any other disease, and we recommend gastric sleeve.
Okay, some patients from UK think that they will lose more kilograms with bypass. Is that correct?
No, it's roughly the same.
Okay, thank you, doctor.
Another question is how many kilograms can a patient lose?
More or less, first month, we can say 10% of the patient's total weight. Third month, 20%, and 6th month, 30% of total weight. First year, we can say 40%. Of course, if the patients follow the rules and diet and sports, of course.
For our dietitian, what can a patient have to do not to gain weight again?
Not to gain weight again. They need to do their diet, and exercise is very important. They should eat proteins, and for every meal they should take a protein, no carbohydrates, but no sugar, no chocolate. They need to do their diets.
Thank you.
Dr. Mehmet, we have so many patients from all around the world. I know it, but would you please answer how many days we need for the operation?
3 days in hospital, 3 days in hotel, Tuğçe. 1 week is enough for us, so we need to another check before we leave. They leave the country.
Okay, then is it safe to have flights after 7 days? For example, USA.
Yes, no problem with airplane trip. We will give the patient blood thinning injections and anti-embolic sacs before the plane. They will apply their sacs and injection every 2 hours in plane. They will walk, and there will be no problem.
Okay, thank you.
Dr. Mehmet, what about the recovery time? Mostly they're asking when can they go back to their work?
Murat, our risky period is first month. The risks of surgery continues in the first month. If our patient's job is mild, so he or she can start after 10 days from surgery. If the job is heavy, they should rest 20 days or 1 month.
Okay, thank you.
Because it's laparoscopic surgery, the recovery time is very short compared to open abdomen surgery.
Dr. Mehmet, we have so many patients and they're afraid of this operation. Me and Murat are encouraging the patients to have the operation. Would you please tell me, is gastric sleeve bypass any weight loss surgery worth it for any complication and pain?
I can say yes, of course, because obesity is a disease, and also obesity invites other disease, such as diabetes, high blood pressure, heart disease, or joint disorders. If this is not the case for our patient for now at the moment, it will be soon. Also, obesity, number one, is the leading cause of sudden death. It's very important. Why don't we treat the harmful effects of such an obvious condition if possible? I think we should treat it about this surgery. And the surgery is definition solution about obesity. Also, we recommend patients who failed 2 years with diet and sports. If they failed after 2 years, and they will suitable for this surgery. And complication rates are very rare.
Okay, I can understand that obesity patients should have this first step to be more healthier then.
Yes, of course.
Okay, thank you, doctor. We have some questions to Sarah also about diet after the operation, before the operation. You say that after operation, a patient must have strict diet. What does that strict diet means?
After the surgery, post-op second day, we are starting the liquid diet program, and first 15 days they should do the liquid diet period, because the first 15 days is very dangerous for the leakage, and they need to do this liquid diet. And this is a little bit strict, but this is not very difficult for our patients, because they have now very small stomach, and this is not difficult. This is the optimum diet for their first 15 days. And after them we are starting the pre-diet period, and then the solid diet period. Yes, we have a little bit rules until third month. We have a little bit forbidden foods like spices, onion, garlic, lemon, which is increase the gastric acid secretion, and I think that's all. I think this is not very strict diet.
Okay, I can understand that after this operation, aftercare is so important. And for that, we have 24/7 helplines within Dr. He, Dr. Mehmet, and you, and all the medical team. Mm-hmm. But I want to learn that after the operation, for example, 1 year later, 3 months later, will a patient have cravings for food?
First 6 months, no, but after 6 months, the ghrelin hormone is a little bit secretion again, and they can feel cravings, but not so much. But they feel full very early. For example, or very with the small portion, they will full. They will feel full.
Okay, thank you, Sarah.
Another question I would like to ask is, of course, in support groups, I heard that many of my patients talking about feeling depressed. Is it normal after the surgery?
First 15 days or first 1 month, yes, they can feel depressed a little bit, because their life changed, and they have new diet periods, and they are coming from abroad, and it's very normal feeling depressed, I think. But after 1 month, they are seeing the change on their body, and it makes very smiling, and it makes very happy after the 1 month, I think.
Yes, Murat. First month, they may have difficulty.
Yes.
But as Sarah said, after first month, they will be normal. Also, chewing is very important for human.
Yeah.
So understood when you lose, but they don't be worried because this is temporary. As we lose weight, our patient will be good mood and forget about these difficult days.
Yes.
But yes,
Okay,
it's
thank
very
you.
normal.
1 year later, they will be happy.
Not
1
1 year,
month later.
1 month
1
later.
month.
1 month later. Okay, thank you. I want to ask to all of you, Sarah and Dr. Mehmet, emotional eating is a real problem, especially in these days. What do you recommend for emotional eating?
Emotional eating doesn't occur in the first 6 months, but however, the studies are indicated that 38 or 40% of patients suffer from the emotional eating problems. But this is not a small rate. But and we are the dietitians try to teach the proper eating habits, but after the surgery. But emotional eating problems are not ours. The psychologist interested, and if they need if they thinking they have this emotional problem, eating problems, maybe they can go to the psychologist. We suggest that the patients who have experienced emotional eatings the 6 months after their surgery should get help from the psychologist.
Yes, we also strongly recommend that they get professional support. Of course, we will support them. And as Sarah said, we will teach how to eat and diet, balanced diet. But if they need to be take professional support,
Yes.
and long-term support.
Okay, thank you very much.
Our patients also contact us from our support group as well about reading the labels. So they want to know how to separate the healthy foods and unhealthy foods.
Unhealthy foods.
So
Yes,
could you give us some tips about it?
Yes, this is very important. First, they need to look the macronutrients like the proteins and carbohydrates and fat, and then the sugar also is very important. And the amount of the sugar written in the package, the product indicates both natural sugar, such as milk sugar and fruit sugar, and the writing added sugars. Like glucose syrup and high fructose corn syrup and rice syrup. So there is no discrimination. And in other, to make this discrimination, we can look at the list of the ingredients, and they can see on the ingredients, for example, sometimes writing glucose syrup or something like high fructose corn syrup. And so what is the list? They are the ingredients writing at the another side of the package, and you can see everything's on this chart. And in addition, it should be checked whether the amounts between the table nutrients of the chart, sometimes writing 100 grams for 100 grams, sometimes writing for only, for example, per one pack. And you should look the grams of the package grams. For example, the package gram is 200 gram, and the chart is writing for the 100 gram, and you need to calculate it for twice the like sugar or protein and fat. But first you need to look protein and carbohydrate rate.
Thank you, all of you. Thank you joining this video conference. I hope this virus will end as soon as and we will start operations. I want to say that we are supporting our patients 24/7, and we are having new patients for the future. I want to say our patients, you are not alone. We are here, but we are at our homes. We are avoiding ourselves from virus to help you the best. We are to do our best. I want to say to patients, please stay at home and avoid yourself from virus. What do you want to say, Sarah?
Yes, first they need to stay at home, and they need to eat good things like the vegetables and fruits and proteins for the immune system, and probiotics. This is very important, and vitamin C, zinc. These are very important, and they need to eat very colorful things like, for example, fruits. Every color of fruits. Not only, for example, not only banana, apple. Yeah, very. They need to do the very various, and I think that's all for me. Water is very important.
Water.
Yes, and protein. Protein is very important for the immune system.
Okay, Dr. Mehmet.
Yes, it's very hard to stay at home in these days, but it's very important and mandatory. Also, I miss my hospital, operation room, surgeries, Dr. Hassan, our team, but we have to be patient. For our patients, they should be stay at home. They cannot go to gym, but they can do their sports in home. So they need to be move a lot. And of course, as Sarah said, a regular and balanced diet is very important.
Okay, you, Murat?
I just want to say, stay at home and stay safe until this pandemic is gone. So please take care of yourself, and I hope we will see each other in the future soon.
I hope to. Okay. I miss you guys.
By the way, Dr. He says hi, all of you and all the patients. He can't be in this program, in this video conference, because he's having a video consultation at the moment. I know he will watch this video conference. We will publish this video on YouTube. I hope so many patients will watch this conference.
Yes.
Okay. Thank you very much.
Bye-bye.
Bye.
Bye-bye.